streaming on this one. Oh, it says stop streaming. Good. Whew. Hello, everyone. How are you today? Good to see you all. I am very techie today, so I just wanted to let everybody know that. We are all techie. So, what is she in there doing? All right, so we're opening it up. What questions do you have? So, let's open the questions. So this is a knife safe zone. So any questions that you have regarding GLPs. So follow me on this page and follow me on my other page. I have my backup page as well. So this is what we like to do is we can do a free consultation. So while we get everybody on here loading up, anything that you want to know about GLPs. All right, guys. So anything GLP related. So that is your S and your T. We talking a lot of code around here, so I just want to let you guys know that. But regarding codes, so if you don't know what we're talking about, put your message in the questions down here. And what we will do.
Echo going on.
Uh-oh, we have an echo. So hold on a minute. Anthony's going to fix our echo.
Might be from that.
All right. Is that better? Now you don't hear me at all.
Hold on, I turned mine on.
Oh, hold on a second. We're trying to fix the echo. Do you guys still hear the echo going on here? All right. So we will do, somebody said it's him. You're not echoing. I'm not echoing. All right. So maybe it's, yeah, one of the, Rosemary said I'm not echoing. She said it's you, not me. All right. So maybe they fixed it. They clicked off something. I actually have 3 systems going right now. So I'm like super techie today, just to let you know. All right. Thank you for saying that. But so I'm Angela. I am a nurse practitioner, and we are definitely here today. So if you are on any other of the systems, what we are doing is I am trying to have my backup page. So that is Recrea Wellness. And if you are on Recrea Wellness, please follow on my main page, which is Recrea Health. And you can find that in the bio. So any questions go. We are a safe place, and if you are not here to be safe and if you start being mean, we get rid of you. So we want to open this up to any questions that you might have. So what questions do you have regarding any of your, do I have, huh?
You gotta fix one other thing.
Oh, Anthony's got to fix something else, and I think we need to turn that down because it is very bright.
Okay.
Although it does get rid of my pimple, so that might be a good thing. All right, guys, we're trying to.
It's too far, need more.
More center?
Yeah.
Okay, so new to your life, I just started the GLP patches. What are your thoughts? So I honestly don't really like the GLP patches. I tried the berberine ones and I didn't notice anything particular with them. I did them for 2 weeks and they didn't stick. So honestly, use your bunch of numbers. Please let me know what you think after you've been on them for a little bit, because are you actually doing the Semaglutide ones? Did you get them on TikTok or did you get them from a prescriber? So I'd be interested in your thoughts on those. Vicious Trollop. I'm not losing or L-ing much W on. 6 and 3. Okay, so what we do is we offer a free consultation, Vicious. So not everybody is the same. So for women, it's 1 to 3 a week. For guys, it's 3 to 5. So what I highly recommend is we do a free consultation. So I would highly recommend reaching out to us and really it is important to reach out to us, and you can do that here. You can DM us, and we would really love to talk with you because it's not only calories, and sometimes if you do that deficit for too long, it can really be a problem, and you will stop the L. So you really want to reach out to us and kind of go over that with you so we can give you that free consultation. Watch my middle pinned video on this page. Go to my other page, Recreal Wellness, and watch the pinned videos up there because I've done the free consultation on my other page. And honestly, sometimes you have to look at the calories. You have to look at your protein. You have to look at your activity level, because if you are actually doing the exercise 5 days a week, sometimes that might be too much and you're not taking in enough calories to support that. So we really need you to kind of look at us, or I'm sorry, talk to us so that we can help you figure out what's going on, because you have to look at your age. You have to look at how much L you have. And I had a consultation I did today, and the lady actually was in that magic BMI of that 24.9 to 28. And when you get there, it's hard. Your body doesn't want to let it go. So a lot of times when you get to that close spot, we really have to work hard. So that's when it's important to, talk to somebody to really, figure out what's going on. Kathy, on MJ, how do I eat? Not hungry. So what I recommend is if you aren't hungry, you need to decrease your dose, okay? Sometimes it's really, really, really important to decrease your dose. And Vicious Trollop, if you look at those videos and you're still not sure, then reach out to me. User bunch of numbers, they're the kind patches. I have not heard any good results with those. So if you do them and you're not sure, I know the price is really good, but I haven't heard any good results with those. So I would recommend reaching out and talking to me and seeing what is going on. Nikki, please, we do a free consultation and you don't have to pay anything until you actually purchase the meds. Our price is $299 in most states for S and $450 in most states for T. Okay, so somebody's asking a question on the other page as well. So I'm going to I'm going to read the question and answer on both pages so you guys can see definitely what's going on. And if I get behind, then I would recommend going to my other page because I'm mainly concentrating on the questions on my main page, which is Recrea Health. So will you see... Okay, so how do you go off is the question. We recommend weaning off. Weaning off is really, really important. So what you want to do is decrease your dose and then inject every 10 to 14 days. Highly recommend doing that. So that's really important. So the average decrease of W is 1 to 3 a week for women, and guys are 3 to 5. So I don't like the guys so much. So that's really what we do see there. If you have that dreaded stall, and we do see that a lot. And when you do that, we have to look at the calories, we have to look at the protein, and we have to look at your age, we have to look at the BMI. A lot of times when you get into that close BMI of that healthy, then you will see that stall and it's miserable. But there's ways to get around it, but it becomes hard, so you have to work at it. And we can help you with that. That's why we do that free consultation. We can actually service 47 states. So, definitely reach out to us. If you want to stop the GLP, should you wean off? Absolutely. I recommend weaning off all the time, because if you cold turkey off, that noise is going to come back so intense, and you don't want that to happen. You never want that. I mean, that noise is crazy. I am currently off because I have to have surgery this Thursday, which is really going to suck, but I'm still doing pretty good. I was supposed to inject yesterday, so I'm just still within that window. But, I have noticed, actually I haven't noticed that I'm really that hungry, but I'm making sure that I'm doing my protein, and that's what I really think. So Ashley is asking which one is the healthiest. Honestly, they're all healthy. They're all good. The current research is saying that they're fantastic. So I always start people out on Sema just because it's so much less expensive, and I educate. So if you watch my middle pinned video, then you can really do well. And that's my middle pinned video on my main page. But if you watch the 2 pinned videos on my backup page, which is Recreal Wellness, you will see some really good information in all 3 of those videos. So I really highly recommend that. So the allodynia, I have heard that. You're going to have to refresh my mind, though, because I just had a major brain fart. So I'm sorry about that. So a lot of people are slow responders, and slow responders are okay because if you have slow, steady, consistent L, you're going to be the one that's going to keep it off, which is a good thing. That is a good thing. So our cost is $299 for S and $450 for T in most states. And we do cover 47 states with a physician that I work with that has a 50-state license. So just to let you know. All right, let's see. So this is on the Recreal Wellness page. Somebody's asking a question here. And so this is, will month 2 see more? It doesn't matter what month you're on. I L'd 4 after the first month, but my face also looks less swollen. A lot of times people will notice their face, the women in their breasts and in their stomach. So you're going to notice inches. Sometimes you don't necessarily notice it in the numbers. I recommend getting a scale that's going to look at the muscle, the water, and the PHAT. Because if you're looking at all of those numbers, then you're really going to see a big difference, because it's not always just in the PHT that we're actually looking at a lot of different stuff. So Veronica, can you put in the notes what S is? It's the name of the GLPs. It's the generic name of it, because we actually have to talk in code on here because we get in trouble. So just to let you know. So if you want a free consultation, you can always reach out to me. Doesn't O have bad side effects? Not if you do what I recommend in my videos. We do a lot of teaching and educating, which is really important. So there's not a lot of bad side effects if you really are watching your simple carbs. Simple carbs are typically what cause the bad side effects. If you are watching making sure that you're getting your protein, making sure that you are getting your complex carbs, making sure you're staying well hydrated. I had somebody here, Hormone Balance Mom, is asking about leg cramps. Hydration is extremely important. Making sure that you are getting your electrolytes, because you have to make sure you're getting those electrolytes, because if you don't, you are going to have dehydration and leg cramps. And that's really important as well. You can also have nausea. So you need to make sure that you are getting, if you're having nausea, go down in your dose. You want to make sure that that is it's staying down in dose is very important as well. You also, you want to make sure that you're followed by a provider that is really paying attention and giving you the attention that you need. When you're going through a pharmacy or you're going through anybody, you need to be able to call a person and talk to them. If you can't talk to an actual physical provider, then that's a problem. You need to be able to talk to people. If you are noticing that you are getting dizzy on any of these medications, then you need to reach out to your provider. That could be your blood pressure. That could be your blood sugar. So you need to find out which one it is. It could be your heart rate. It could be dehydration. So you really need to find out what's going on and talk to somebody about that. That's really, really important. You're welcome for my information. I am seriously just here to talk to you and give you information. I am not giving medical advice. I personally have been on these for 3.5 years. I have been prescribing them for 3.5 years. So I really try to just make sure that I'm educating. So the patch that I had was pink as well. So I really don't like the patches. I have not had anybody on any of these lives tell me that they have had any good anything good from them. So just be careful with them. And so if you are having any kind of tingling with these, if you're having any kind of swelling or hives or any rashes, so then I would recommend that you reach out to your provider. You are having something happening with them. Hair loss. So you need to make sure you're getting your protein. And before anybody says anything, I have had thin hair since I was 17. Being on these, I have not lost more hair. Okay? I have always had thin hair because somebody always wants to be mean and point out the fact that I have thin hair. We know this, okay? This is a known fact. Okay, you need collagen. Okay, collagen is extremely important, but this is available here, or you can DM here on TikTok and I can help you. So what I would highly recommend is collagen. This also has 10 grams of protein in it, so it's really important. And if you are on YT and you are seeing this, because we do have one person on there, this is available and you can reach out and we can get you some information on this. Then also you can do this one. So this is important as well. So this is a vitamin that you could take every day. Also on my TikTok page is this. So you can reach out to Recrea Health on TikTok and we can help you with this. This is available on my page. So protein is what is so important. So you want to do protein, and protein is, I know collagen is not a complete protein, but it is an option to get some more protein in you. So what you want to do is you want to get 80 to 100 grams of protein a day for women, just as a minimum. And then guys need to get 100 to 120. But you need to make sure that you're getting a ton of protein, not a ton of protein, but every pound of protein that you have, you need to add in another gram of protein. So that's where I like those scales. So this is another option of protein. I personally can't do whey. This has whey isolate. And if I don't drink this every day, you need to be doing definitely some other protein. Okay, low T more meme 1. You should not be counting collagen as a protein. Okay, you know what though? If it's a way for people to get some extra protein, this is a marine-based protein or a marine-based collagen. So it is actually a good source of collagen, which gives you 10 grams. I'm not saying it's enough protein, but it's getting some protein in there. But your point is heard, okay? So can we stop arguing? But you can keep putting up comments. That's great. Go ahead and keep saying it. Love your comments. Okay, thank you. Keep going. What else do you have to say there, ma'am? Okay. So get your protein. I like multiple different sources of protein. You want to just try to get as much protein in as possible, but every pound of muscle, you need to add in a gram of protein as well. So what you need to do is make sure that you get a good scale that lets you know exactly how much muscle you have, so that you can match your protein to your muscle, because it really does help. Why did I just... So I do have not 5 accounts. I have 2 accounts. I have Recrea Wellness as well as Recrea Health. Yeah, and today I'm very techie today, so that's why you're seeing me on 2. And then also if you go to YT, I'm on there as well, so there you go. But definitely, so we do S and T, and we can service 47 states, and we are definitely able to help you in a lot of different splits. I am everywhere, Ashley. Yes, definitely. My whole goal is to try and teach and educate, and I really could care less if you get anything from me. I really just want to teach and educate. I am trying to make sure that people are staying safe on these medications, because people are getting them and nobody is telling them what to do. I had a gentleman in my office earlier today. same situation. He is getting his medications and he didn't want to take them anymore. His wife basically drug him in here because he was extremely unhealthy and he wanted to lose the W, but he wasn't having the right success. And, he was sick on these. And she was like, we really need to talk to somebody and see if there's an ability for us to have you take them and be healthy. And so she got him in here. And when we were done with this consultation, he's like, nobody ever told me this. And he was eating all of the simple carbs and was extremely ill on them and drinking a lot of beer, which is a simple carb usually. And he was like, well, why am I sick? And then after we talked about it, he's like, oh, well, that makes complete sense. So that's why I do what I do, is to try and just help people feel better. So that's why I'm here, because I really, really just want to help people be able to be successful on these and just help people not be sick. Body, how do I L the belly? So L-ing the belly is going to happen, but it depends on, a lot of that has to do with the insulin resistance, but it can also do with your hormones, which the insulin resistance is going to help with the hormones. It definitely will. So give me a call. We could definitely do a free consultation and talk more about that. But exercise can have stuff to do with that too. And it really depends on how much, so we can help you with that as well. What do you do the days that you can hardly eat? It's so hard sometimes. Decrease your dose. Definitely decrease your dose. If I'm not getting your question on Recrea Wellness and you're on there, you could definitely go to the Recrea Health and I can get you there too. So just, I am popping back and forth just to let you know. But if you can't eat ever on these, you need to decrease your dose. It is so important. And, protein definitely helps. If you can't eat, you definitely need to take your protein. Protein is so important. And long-term health effects, actually, they have been finding a lot of amazing research. And the research is showing they're really good for you. And it is so crazy how good they are for you. So just on the Today Show, I think it's probably been about 3 weeks ago, maybe 4 weeks now, that they are showing that the American Heart Association has shown some great benefits to the heart, and they are probably going to start recommending, if you have heart disease, to take these. And then probably 2 months ago, the Today Show had on it with Alzheimer's disease. So they're really showing some wonderful benefits to it. Can S cause irregular periods? Yes, they can, because insulin resistance has issues with PCOS, or helps PCOS. Can also affect fertility. So PCOS affects your hormones. Insulin resistance helps that as well. So when you start taking these, it is going to start causing problems with your fertility. With your menses. So what I tell people, first, make sure you're not pregnant. But second, talk to your GYN. Go to your GYNs and your OBs to make sure that everything is going okay. So if you get pregnant on these, you need to stop immediately. If you're trying to get pregnant, the GYNs are recommending that you go off of them immediately. But you also, if you're trying to get pregnant, you go off 2 months in advance. So talk to your GYN, but yes, they can affect your periods. I was L-ing fast, plateau. So when you plateau, you have to reach out to your provider. You can reach out to us. We do a free consultation. We definitely can help you. Because what you have to do is you have to look at your calories. Women are typically 1,300 to 1,400 calories a day. Guys are typically 1,600 to 1,800. There are some factors that are thrown in there, but we have to look at your age. We have to look at your muscle mass. We have to look at some different things that are going on with you. So just reach out, because BMI has a lot to do with that as well. So sometimes you just have to shock the body. So R is the one that somebody was just asking about. And R has not been released by Lilly. I was just told by the Board of Pharmacy in Ohio that I am not allowed to prescribe it, and it is not FDA approved. So we do not prescribe it at my clinic, and none of my pharmacies that I work with are they have it available. So R is not available. So just to let you know. What helps with the brain fog? Making sure that you are taking a good vitamin, a good multivitamin is really, really important. And that is something that you want to definitely check into. I like the vitamins that are like over 50 because they have a good amount of everything in them. So like your calcium and all of those things. But making sure that if yours doesn't have B12 or B6 in it, something like that is really good. I like this, and I'll show everybody else here in a second. You can get this here, and here. So this is something that is really good. This has a lot of your B vitamins in it. It has a lot of your other energy support in it as well. So this is something that we really like, and it can help with that brain fog also. But it's usually your vitamins. So has anybody, this is a good question that somebody's asking on one of the other spots, if anybody have any dizziness or vertigo at all? So could you please put up if you've had any dizziness or vertigo and ringing in your ears, because that might be something else that some people have had. So has anybody else had anything like that going on? Could you please put that in the comments? All right, thank you. How do you feel about compounded? I have only dealt with compounded. I have actually never done name brand or have I prescribed it. I've tried to do the prior authorizations for some people, but I've never had it actually work for anybody. I've had people come to my clinic and start my medications after being on those and tell me that mine are more effective, but I've actually never tried them personally myself because I've never had insurance outside of the VA. And so I personally don't have an opinion on them, only what patients have told me. I personally like the compounded better. Well, Sarah, I've not actually had anybody have an appendectomy issue with these. And I have to research that because I've not been told or seen in the research that, having an appendix issue with the GLPs is directly related. But anytime anything happens and you're on like a new medication, that's immediately what they blame. And that's true. So it is something. So the person that asked about the vertigo, on the other page, I have had somebody say that they do have dizziness. Actually, 2 people so far have said that they have had some dizziness. And, you can have dizziness when it's low blood pressure, low heart rate, or it could be low blood sugar. So Sarah, if you're asking me if you should continue, you might want to ask your providers because if they're thinking it was related directly to being on these medications, which I've never heard of that, but I would definitely talk to your providers about that one just to be sure. My meds were left out for a week before opening, no response from the online provider. Gotta love these online places, people. I hear it all the time that you guys can't get a hold of them. I don't know. Every pharmacy is different in what they recommend and what they say. Ours that we use can be left out for 21 days and they're okay. So everyone is different though, and I'm not sure what to tell you about that. I would try to reach out to them again and see. I don't know what to tell you on that. I am so sorry. I have no information on R, Leslie, so I can't tell you what to say. And M, I don't know. I would say try to reach out to them again because ours is okay 21 days out of the fridge, so I don't know what to tell you. I am so sorry. I don't know, Janie, about what you're asking me on. No, Kim, I have not seen anybody's insulin levels go up, way up. Everybody is really different. All right, so Natasha, Morningstar, what I recommend when people are starting GLPs, I recommend starting on Sema. And the reason is because of pricing. And a lot of people do really, really well on it. Watch my pinned videos on Recrea Wellness, but then also go to my other page, which was Recrea Health, and watch my middle pinned video on that page. You need to be very well educated when you're starting these meds. You need to make sure that you are staying safe. So you can get your meds through us, and the starting price, not starting price, the price is always the same. And what you can do is you can go here or here, and you can DM us on TikTok. So follow both of my pages. So what you want to do is it's $2.99 for S and then $4.50 for T. And that's in most states. We can serve 47 states. I work with a physician who's fantastic, and he has 50 state license. I also have multiple state license, but I also have a compact license as an RN in multiple states as well. So immune support for GLPs, they've actually shown a lot of really, really good information. So, and Amelia, you are definitely able, there is no contraindications for anybody with thyroid issues at all. So we can definitely help you. So everybody, please, what I would recommend, if you guys could, what protein do you take? So what protein do you recommend? Because there's on both pages, people are asking, what do you do for protein? How do you get your protein? So could you guys please put your protein up and what you do? Because protein is how you break that plateau. This is how you break a plateau. This is really good at helping with the plateau as well. And so our pricing is a monthly price. So I do highly recommend for that monthly price. So everybody is throwing up their protein and what they do for protein. Thank you, everybody. That's fantastic. That really helps everybody out. So women are typically 80 to 100 grams a day for protein. Guys are 100 to 120. It depends on how much muscle you have. If I am not getting to your question, please DM me, or you can text, is fine as well. So please reach out, and we would be more than happy to answer your questions. I do get behind because I do spend a lot of time on each question. So please definitely reach out. So I'm going to have to actually, John, I'm going to have to look up this new study that you're talking about that was recently released from the New England Journal of Medicine. I will check that out. I'm going to write it down. I have surgery on Thursday, so this will be a good thing for me to do while I am recovering. And this is going to GLP versus GLP-1. So I will look that up, John. Thank you. Prednisone. Prednisone increases your appetite. So the GLP will hopefully help keep that under better control, but there's not really any difference about that. Tiffy, don't be scared. It is wonderful. Watch my pinned videos on my Recrea Wellness page, and then watch the middle pinned video on my Recrea Wellness page. Definitely recommend that, so please do that. So, the benefit on menopause, sorry. So the benefit on menopause is that it definitely can help because it's not really going to affect it that much, but it does help with that insulin resistance, which is great. So what I would it's not really going to do anything for it or against it, but we also do hormones here as well. We do bioidentical hormones. So if you're interested, for $199, you can get your labs checked, and that includes your first month's hormones. So if you would like to reach out to us. If you are exhausted and you're on these name brands, then you definitely need to make sure that you're on a good vitamin. You need to make sure that you're getting a good B12 vitamin. So if you're on estrogen patches, are they bioidentical patches? Because you want to make sure you're on bioidentical patches as well. So Riley, if one gives you side effects and the other one doesn't, that's why they're different medications. They're one molecule different. So S and T are not the same, and one might give you side effects and one might not. So it definitely, it can happen. So when you're trying to go up on these, always follow medical advice. Do not do it on your own. Make sure you are talking to somebody. So if you're going up, you need to make sure you're following what your provider is telling you. Definitely. Yes, if you're on HRT, which is hormone replacement therapy, yes, you can be on GLPs. I've been on them for 4 years together, and I've been on GLP for 3.5. I've been on HRT for 4 years. So absolutely 100%. Does alcohol lessen the effects of the GLP? No. Actually, what happens is the GLP will make you not want alcohol, and the GLP will affect how you respond to alcohol. So if you're going to have alcohol, make sure you're careful, because when you drink the alcohol, your alcohol is you need to drink slow the first time, so that you can make sure that you know how you're going to respond to it, because it might take you longer to get drunk, or it might take longer for it to affect you. If you are exhausted, make sure you are getting a good multivitamin, and make sure if it's clear or it doesn't have B12 in it, that you are getting a good B12, or, you're getting a good B6 in there also, or, you're taking a good vitamin. I'm splitting my semaglutide dose across the week. I'm not a big fan of the splitting of dose, but if you work with your provider and your provider says that's fine, then that's okay. Because if it's working for you, it's working, and that's okay. So if you get stuck, a lot of times, especially if you've had a rapid L, your body is going to stall to catch up, and that's fine. But if the stall, you can't break it, then a lot of times you have to reach out to me and do a free consultation, and I can help you. But you've done fantastic. I mean, that is really, really good. So guys, this TikTok just dropped a whole bunch of comments, and I am sure that I am not going to be able to figure out where the heck I was just at. So please, 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 if I missed your question, please reach out to me via DM, or you can go here and just send me a message, because I have no idea why it just did that. I think I got too far behind and it didn't like it. So please reach out to me. Make sure that you are getting your protein while I try to figure out where I was. Yes, there is a huge difference between GLP and metformin. They are completely different medications. They work completely different. So what I would recommend is that you talk to your provider to figure out which one works best for you. Metformin is extremely cheap. So a lot of times the doctors will go to metformin first, or you can be on both. I've had patients be on both and they do great. So Julian, I want to be an NP, but I don't want to give up my 4 days. What area of NP can be do 12 hours? I love being an NP. I absolutely love it. So a lot of people get sleepy because they're not getting enough calories. So that can be, you're not getting enough calories, you're not getting your electrolytes, you're not getting your B vitamins, you're not getting a lot of different things. So you really need to try to make sure that you're getting a good amount of your calories and your vitamins and all of those things as well. If you don't have an appetite, make sure that you are dropping down your dose. Talk to your provider and decrease your dose. So somebody keeps asking the question about vision. If you have diabetic retinopathy and you take these, you have the chance of having vision loss. So you need to make sure that you are talking to your ophthalmologist, talking to your primary care doctor, because that is a risk. And if you don't have diabetic retinopathy, then the risk of vision loss is very, very small. So, you definitely need to reach out to them. Yes, we do prescribe Lipomino C. It's definitely a harder shot to give to yourself. And so that's something that you can definitely do. I've been on GLP for a few weeks and I'm still hungry. So it will change. Make sure you're getting your protein. Your protein definitely has a lot to do with the cravings. So you definitely need your protein. Very, very, very important to make sure that you're getting your protein. Oh my goodness, Amaya, you accidentally took 10 times your dose to first. You were probably really, really sick after that. Oh, wow. That's crazy. I would definitely go back down on the dose just so you don't make yourself sick, but definitely talk to your provider on that. So after pregnancy, you need to talk to your OB, but if you're not breastfeeding, you should be able to start it pretty quickly after. But if you're breastfeeding, you cannot take these. But you definitely want to talk to your OB after that as well. Constipation. So constipation, when you have constipation, I have tons of videos on constipation. Constipation is one of the biggest issues that people have. So you have to make sure that you are watching your bowels. You want to make sure that you are taking your fiber every day. So you have to take, I like Metamucil gummies. I start out 1 a day every day for a couple days, 2 a day every day for a couple days, and then 3 a day every day. Then, of course, you know, like you said, lots of water. I found this. I'm going to show you guys. All right. This is on my TikTok shop. I actually like it a lot. It's a probiotic. It's 6 probiotics, but it also has 10 digestive enzymes, but it's also good for women's women's vaginal health as well. So this is really good. It's available. So you want a good probiotic for your bowels as well. But then also, I personally like Miralax. I take it almost daily. So if you're not having a bowel movement every day, you need Miralax. You can also do Mag Citrate or you can do Mag 07. Whichever one you want is great. It's fine. Do whatever you want to do. Then I really like the this one is okay. It's really for those 2-3 days you don't go. But then if you need something strong, this is strong. And I posted a video on this today. It is super, super powerful. So be very, very careful with this guy. I would recommend taking one, and somebody is saying that they're on both. So definitely be careful with the second one because it is pretty darn powerful, but I do highly recommend doing that. Sarah, I actually did not know that there was a lawsuit against CVS making people switch. I'm sure that's going to be an issue because these insurance companies are actually making people switch. And I think it's ridiculous. I actually I'm an adult nurse practitioner, and I was trained as an adult nurse practitioner, so I don't see anybody under 12. And I was in geriatrics for a long time, and then about 9 years ago, I just went to straight adult. So that's how I've done a lot of like specialty trainings as I go. Somebody had asked about a rash on at the injection site. A lot of times I think it's the alcohol swabs. So stop using the alcohol swab, then use soap and water. You can do nothing if you just like make sure that the area is clean. Then if you still have it, have them switch what they are using it to mix it with. So if it's compounded, it could be the B12, it could be B6. So it could be something like that. So you just want to make sure. Kim Woodman, order from me. I don't know who that is that you're saying. So I would say order from me. Ours is $2.99 for S, and that's a flat rate. And then also that's for S, and then RT is $4.50. So that is what I would recommend. And so the patches, I would stay away from them because, you know, I've not had very good luck with those, and I would not recommend those at all. And so lowering the dose is going to help with any of the nausea, the vomiting. It's going to help with, you know, any kind of those side effects, the dizziness. It's going to help with any of that. So you want to make sure that you are decreasing your dose. Make sure that you're getting your electrolytes, because if you get dehydrated, you're going to have that dizziness as well. So if you're having a lot of hunger and cravings, or, you know, make sure you're increasing your protein, make sure you reach out to your provider. Reach out to me for a free consultation, or, you know, you can DM us on this as well. We are here. So definitely help us. So the patches that are sold on TikTok, I don't want to say that they're dangerous. I did see some videos where people were having really bad skin reactions to them. I don't think they're effective. I really don't. I didn't have any results at all. So I would definitely Yeah, I would definitely stay away. So, Nicole, menopause lady here. I'm on progesterone and estrogen. How do they mix? I think a lot of times that when you're on estrogen and you still have your uterus, you need progesterone. That's almost always. I have found in my practice that almost every woman over the age of 35 needs to have testosterone. And it's really crazy how that works, but it really is true. So how should you eat if you're on these? So what you need to do, no simple carbs. You want your complex carbs. And so no simple carbs is you're not eating anything processed to be white. If man made it white, don't eat it. If it's naturally in the earth, then eat it. Then you want your protein. Protein is so important to prevent your hair loss, and protein is going to help prevent your muscle loss. So you need to make sure that you're getting your protein. Very, very, very important. So diet is so important with these. Leg cramps or any cramps in general. You want to make sure that you are getting your electrolytes. Make sure that you're staying very well hydrated. That's very important as well. So watch my middle pinned video on my Recreal Health page, and then watch my 2 videos on Recreal Wellness. Both of them are really, really good videos. They're wonderful videos, and they're going to give you all the information you need as you get started, because you really need to have a lot of education and a good base of knowledge, because the simple carbs are what's going to make you sick. And then you need to make sure that if you are still quite questioning and you're not exactly sure, reach out. Definitely reach out and we can help you. You can DM, you could follow me. Make sure you're following my pages. Please share my live. I would really appreciate it. I am just here to make sure that you are educated. And I really, really want to make sure. So if you are hungry, increase your protein. That is so important to make sure that your protein is up there, because the protein is going to help. And what's super cool about protein is a lot of times there's so many different flavors that it helps with a lot of those cravings as well. Yes, Eileen, is there a risk of getting pregnant on these? Absolutely there is. So they increase fertility. That's why they're used for PCOS. So if you are of getting pregnant age, you need to make sure that you're protecting against getting pregnant, because you definitely can get pregnant on these. We have about 9 or 10 ladies that have become pregnant while on these. So you definitely want to be careful of that. Can you offer what to eat and what not to eat when we call? Absolutely, 100%. We actually will send you information, but the simple, and there's blogs here and here. So there's blogs if you want to look at that, so that you can find out what is, really. I don't give you a meal plan, because what I eat, what you eat, and what everybody else eats is so different. What I give you is simplicity. Okay, so if you're looking at food, if it is processed to be white sugar, flour, pasta, rice, don't eat it. Okay, it's going to give you indigestion, belching, nausea, might make you throw up. Don't eat it. Okay, those are the things that put us in the situation to begin with. What you do want is things that are naturally in the earth. So your vegetables, roots, potatoes, whole grains, oats, you want those things. 25% of your diet is those things. Okay, then what you do want is 75% of what you eat is protein. I don't count macros. I'm not going to count macros. And somebody is going to say, oh my God, you need to count macros. I don't, because that makes it complicated. If I make it complicated, you're not going to do it. So that's why I don't do it. So I try to keep everything simple, because if it's simple, we can do it, and we're going to do better at it. And this is what I have taught to hundreds and hundreds and hundreds of people. And I've had hundreds and hundreds and hundreds of people be successful at it. So that's why I try to keep everything as simple as possible, because if it's simple, then you're going to do it. Okay. So that's why I try to keep things simple. So I clump all the peptides together. So all the L's, the T's, the S's, all of them are just clumped in together, okay? because if I clump them together, they all have like their own individual little things. They're all peptides. They all have like one molecule different and all of that stuff. We could sit here and break them down all day long. It's too much. I don't like complicated things in my life. I really don't, because life is too complicated all the way, always anyways. So the blindness. If you have diabetic retinopathy, then they are going to, the increased risk of more blindness is a possibility. The research shows that if you don't have diabetic retinopathy, then blindness is not a risk. That's just from the research that I've read. So that's all I'm saying. So Amber, I don't know if you're just asking, is it normal to have spotting if I have an IUD? For me, yes, it was. But if you're having increase, then you definitely need to reach out to your GYN. Your GYN. All right, if you're terrified to start and lose hair, you don't need to be. Make sure you're getting your protein. Women 80 to 100, guys 100 to 120. Make sure you're getting a good collagen. But as we saw here just not too long ago, somebody was having a fit about not being real protein. It does have 10 grams of protein in it. So, the collagen is really good. I like collagen for hair loss. Plus, it's good for your skin. So it's a really good product. This is a really good collagen. Then also make sure that you're doing a good hair vitamin. So I really do like this hair vitamin. You can also, I found this one. This is a really good hair vitamin as well. This is available on my TikTok shop. So you can find this there if you would like. It's available on both of my pages. I do have a backup page as well. So if you want to go to my backup page, you can go there, which is Recrea Wellness, or my other page is Recrea Health. So you can go both to those if you'd like. So you want to make sure you're getting your protein. And if you want another good option for protein, this is something that you can get. This is available on my TikTok shop. So you need to make sure you're getting your protein. It's definitely something that's good. So a good vitamin that you need to be taking, I like any vitamins that are over 50. So any of those are fine. If you have B12 in your vitamin, you want to be very careful because those can cause, you just don't want too much B12 vitamins, okay? I just want to let everybody know on my Recrea Wellness page that it dropped. I was behind by 99 comments and it just dropped all the way down to the bottom. So I'm probably going to miss some of your questions. And if I did, I apologize. But please DM me and I can definitely answer them, or go here and just text and I'll be able to answer them as well. So GLPs do affect gastroparesis. So if you have gastroparesis, you need to work with your gastroenterologist and your primary care to see if you're eligible to take these, because it can increase the risk of your gastroparesis. So we definitely want to be careful with that. So what I would suggest is working with your primary care on that as well. First, Z injection, 3 having nausea. So 3 days ago. So what I would recommend is talking to your doctor, your provider, and getting Zofran. In the meantime, make sure that you have like peppermint oil, or you're getting ginger. A lot of people swear by ginger helping with the stomach as well. So that's something that you can do. That is a real problem, is the nausea. Usually nausea and constipation are the big issues. So you definitely need to be careful with that. All right. So alcohol. So these meds are actually approved to help with alcoholism. So a lot of times people just lose the ability and they just don't want to drink alcohol. So what we do is, when you drink it, first of all, you want to go with keto-friendly drinks. What that means is sugar-free drinks. And so if you're going to drink slow, because you don't know how it's going to hit you. It may hit you hard right away, or it may take a while and then it's going to hit you hard. So you want to drink slow to see how it's going to affect you. So that is what I said about alcohol. So somebody is having the opposite of constipation. So if you have the opposite of constipation, you definitely need to make sure you're taking your fiber and avoid all simple carbs. Get your fiber, make sure you're staying very well hydrated, and make sure that you are, getting your probiotics. So these are good for women. and these are available on my TikTok as well. But make sure that if you take Imodium, be careful, because what could happen is you're going to flip yourself the other way. But typically the probiotics, the digestive enzymes, which is in this, but also the fiber will take care of that, and cutting out all simple carbs, because it might be the simple carbs that are causing it. All right. So Christina, my eyes have been bloodshot since I started. So I've never heard of that before, so I can't tell you if that's a thing or not. All right. So Angie, asking about menses, or her period several times a month. Yes, because sometimes, you know, like PCOS is related to insulin resistance. So a lot of times what this does is it's trying to balance it out and correct it. So you can have your period several times, and this can affect it. So what I would recommend, Angie, is reaching out to your primary care provider, or I'm sorry, your GYN, and they can maybe see what's going on. Sorry, I can't talk now. Took a drink and I messed it up. So guys, I have just a few more minutes. I have a patient at 3:30 Eastern time zone, so I just wanted to let you know before I got off here. So if you have any kind of like irritation at the site where you're injecting, you can always it's obviously from what you're injecting, but you know, make sure that when you are giving your injection that you're actually indenting. So if you could see how my finger is, you're actually pushing in and indenting to make sure that you're getting into that deep subcutaneous tissue, because you don't want it to be too superficial, because that can definitely cause a problem. So if you are, if your injection is coming with B12, you want to make sure that you're not taking an oral B12 with it, because that could just be too much B12. So, you know, definitely be careful with that, because we don't want you to have too much B12, because you can get headaches from that. You can get like nerve issues with that too. If you're ever concerned, get your blood work checked, and they can check your B12 levels. Okay, I'm trying to get through some of these questions here because we only have a few more minutes. Metformin, yeah, I'm not a big fan of metformin, and plus it upsets people's stomachs a lot because it has to go through your stomach, and it could definitely cause problem. All right, so remember that a normal loss is 1 to 3 pounds a week, or for women, and 3 to 5 for guys. But if you have that dreaded plateau or that stall, you could always reach out, and we could definitely help you, or you can DM, and I will always, you know, answer your questions or take care, you know, help you out with that, because there's a lot that we have to look at. It's so hard to just kind of generalize that on here, but I can definitely take care of it. If I don't get to your question, please follow me. I do a lot of videos. I try to always teach and educate, but you can DM me. You definitely follow me. Both my pages, because I have a backup page. I like to get in trouble a lot. So, not on purpose, I promise you, not on purpose. But follow both my pages. One is Recrea Health, and the other one is Recrea Wellness. So I'm trying to build up both pages at the same time. And, you know, I'm trying to do a lot of education videos and a lot of teaching videos just to make sure that I am getting everybody, keeping both pages alive at the same time. I also have a YT now, so if you can follow me on there and everywhere else, that would be great. That would be fantastic. I would really appreciate it. So if you guys have any questions, please DM me if I didn't get to your question. Is tachycardia normal? No, it is not. But if you have that B12 in there or that B6 in there, that can be a sign of that. So you definitely want to get your blood work checked, because that is something that, you know, your doctor needs to check into for that. Okay, Lori, go to your ophthalmologist, go to your doctor, because you said your vision is worse. So you definitely want to go talk to them. And I would stop these meds until they find out what's going on with you, because that is not something that normally happens, but they definitely need to talk to you about that and figure out what is going on, because, you know, that's something that's concerning. And I mean, I would be concerned, so I would definitely go get that checked out. No, I have not. Well, okay, so if you're having seizures on MJ, but it's not blood sugar related. That is definitely something that needs to be followed by a provider, and you need to talk to somebody as soon as possible to find out what's going on. I have not seen or heard that by anybody else at all. So I would definitely reach out to somebody about that. Okay, I read that question totally wrong. I am so sorry about that, guys. I'm trying to answer a lot of these questions. Okay. Yes, if you have slow transit constipation or if you have any kind of bowel issues prior to starting these, you need to make sure you get your bowels under control beforehand. You have to. You have to make sure that they are under control. So talk to a GI first. So you might even want to consider going on Linzess. You want to make sure that you are taking care of your bowels absolutely 100% before you get on these, because it will make them absolutely worse. So please talk to your provider before you get on these, because that is one of the number one side effects is the bowels, constipation. So there are other spots that you can inject. You can inject your arm and you can inject the outer part of your thigh. So 100% you can inject. So the stomach is the most effective, but the least side effects are the arm and the thigh. So you can definitely do that. I am live on 2 accounts. Nobody else is posing as me. I don't think anybody else would want to be me, to be honest with you. But yes, I'm on 3 right now. So I am being very techie today. I'm actually trying something different. I'm trying to grow 2 accounts because I keep getting in trouble on 1. So I'm trying to build my backup. Is it normal? Already answered that. Sorry, a lot of these questions are repeats and I have answered them. Oh, I actually have been doing aloe as well, and I really do like it. So this is something that's available. So you can, or here and here. So this stuff is really good, and it's cranberry flavored, and I've been putting it in my electrolytes with my water, and it's really good, and it does help keep the bowels regular also. So I do like Mag Citrate and Mag 07. A lot of people have said that they really like that also. So it's really something that's good also. What's the Noon Plan? I've never heard that. I've never heard of that one. Never heard of the Bloodshot Eyes. Never heard of that one either. I don't know if anybody else has ever heard of that one either. So just to let you guys know, if I didn't get to your question, because there's a lot of questions on the, a lot of questions, which is really awesome. If I didn't get to your question, please DM me, or you can reach out here. Please reach out. We are always more than happy to answer. And we do a free consultation. And I absolutely 100% would love to talk with you. Our price is $299 for S in most states and $450 for T in most states. We also do hormones, bioidentical. So I am not affiliated with one certain pharmacy, but I do have one that I love to use. They are based in New Jersey. So anything that you need or any questions that you have, you are more than welcome to reach out to us. I'd be more than happy to help you. I'm more than happy to answer any of your questions. I am only here to teach and educate. I absolutely love answering all of your questions, and I really appreciate all of your support. You guys are absolutely wonderful. I didn't really get to see any of my normal people on here. These are not dangerous at all if you do the things that you need to do. So what I recommend is watching my middle pin video on my Recrea Health page and then my 2 pinned videos on my Recrea Wellness page, because there's so much information in there. They can cause pancreatitis. So what you want to do is, if you've had pancreatitis, you don't want to take these. But it's not very common. It is not very common at all. If you ever develop left upper quadrant pain, then you want to make sure that you talk to your doctor immediately. And so it is definitely important. So R is not available or released by Lilly, and they are the ones making it. And the FDA has advised against using it in the United States. And I just received a letter from the Ohio Board of Pharmacy saying that I am not allowed to prescribe it. So that should tell you a whole lot right there. So if you're getting horrible cramps the day after, then you really need to talk to your provider because there's some medications that they can prescribe you, and you should probably go down on your dose. If you're getting sick after taking them, you should probably go down in your dose. If you can't eat, you need to go down in your dose. So there's a lot of different things that you need to go down in your dose for. You should honestly feel okay on these. The noise needs to go away. And that's really, so go down in your dose. You know what, Kim's long second toe, you really need to not have, that's not a good thing to say. So can everybody please hit your hearts right now so that I can pin this video so that I can actually, so Kim's long second toe. I'm going to say something against her right now because she said that people need to do their own research on diet and exercise. Y'all do anything, all caps, except put the work. So I am going to answer her, and this is what I have to say to what she said to us. So I've been on these for 3.5 years. I've been prescribing them for 3.5 years. I hope you guys are hitting your hearts because I can't actually see this. So what I want to say to this Kim is it works 3 ways. 1, it actually gets rid of the noise. And what it does is it actually helps us get rid of the noise, and it helps us to give up the thoughts that we have constantly nagging us regarding food and cravings. The second thing that it does is it slows down our digestion so that we aren't hungry and we aren't able to eat as much. So it's kind of like gastric bypass, but it's safer. Third is insulin resistance. So diet and exercise can help with that a little bit, but insulin resistance is important because what that does is it's going to start our insulin working better in our bodies, and it's going to start that blood sugar process that is going to get that blood sugar working better and getting it processed out of our bodies. So this is what is aggravating about Kim's comment is you just think that diet and exercise will work. I've done that. I've worked hard at that all throughout my life. But what it didn't do was it didn't work. I would starve to death. I was hungry constantly. I was mean. I would drop it and then I'd put it back on. I would drop it and I would put it back on. So when people say stuff like this, it's so aggravating and it's irritating. But this is finally something that is working for us in our lives, and it's giving us the ability to be able to take control and actually be healthy and correcting a lifelong struggle that we have had. So when people tell you you aren't putting in the work, you're putting in the work and you're doing a good job. And you know what? It's okay for you to use something like this because it's not taking away your ability to fight and your ability to actually, you still have to put in the work. This isn't a magic pill. This isn't a magic jab. This is still making you have to do the work. You still have to eat right. You still have to do the things that you have to do. So when they are telling you, oh, you're just cheating, this is a simple way out, it's not. You still have to do those things. So believe in yourself and believe in the things that you're doing and be okay with who you are and be okay with what you're doing and be you. And you're doing just great and you'll be just fine. So I want you guys all to know that you're doing phenomenal. I am here for you, and people like Kim, you know what they can do. Just what I gotta say. All right, guys. On that note, you have an absolutely wonderful day, and I will be back tomorrow. I think at 10 is what I'm coming on, 10 Eastern. So the truth, mic dropped, and I will talk to you guys a little later. I won't drop the mic because it's pretty expensive. All right. Exactly. Don't let negative people say things to demotivate you. We bring ourselves up and they can all bite my big toe. Actually, her long second toe. She can go bite it. All right. Thank you, guys. You have a wonderful evening. If I didn't get to your question, please DM me, and I would love to talk to you, and have a wonderful day. If you would like a free consultation, please reach out. I love you. Follow my pages. Follow this page, Recrea Wellness. Follow this page, Recrea Health. And have a great day. Thank you guys. Bye. Hang on, I'm still signing off everything here. Hold.